Hi, everyone. Thank you for joining us. We are back with our partner at Rectangle Health to talk today about some ways to boost the reputation with your patients, increase productivity with your team. My name is Jill Hasselman. I'm the Senior Vice President of Strategic Partnerships at HR for Health. And I have Christian joining us, who is an old friend. Welcome, Christian. Thank you for being
Hey,
here.
thanks, Jill. Great to be here.
Do you want to give a little background on yourself before we jump in?
Yeah, happy to. Once again, yeah, happy to be here, everybody. Thanks for joining. My name's Christian Durbel. I'm Director of Enterprise Solutions over at Rectangle Health. I've been in the dental and healthcare software space for about 15 years. Really enjoy it. It's turned into a passion of mine. I like to geek out on these different solutions. I'm based in Kansas City. I have a beautiful wife and three kids, 14, 12, and 10. They're bananas, but it's lovely. And yeah, I've been with Rectangle about 6 years now, and I've been looking forward to this conversation.
Yeah, welcome. Thank you for joining us. What we're going to go through today, a little bit just about HR for Health and Rectangle Health, how we're partnering together, and then really dive into what should engagement look like. Christian's going to go into defining that for us, why that's important, and then we're going to look at some nice tips and tricks of how to boost your reputation, how to increase productivity again from your team, and have that team engagement piece. We are going to do our best to get to questions at the end. If we are not able to, we will be able to see those questions come in through the Q&A, and we will follow up with you individually afterwards. So please feel free to put those questions in. And like I said, if we can get to them, we definitely will. Initially, just kind of an intro for those of you, if you're not familiar with HR for Health, our goal is to really make the complexities of HR easy to manage, while also keeping your employees happy. So the software that we have focuses on allowing you to easily set expectations right from the get-go with your team, and using tools like the employee handbook, which we hold your hand through, creating that and update it as things change, but using employee handbooks and job descriptions and automated new hire documents, like setting the tone nicely from the beginning, in a paperless way that allows that transparency for the team. We're going to talk a lot about what employees are looking for and how to get that engagement that, as a practice owner, you're looking for. And so these pieces of allowing them to have that transparency to their employment is really important, because the team wants to know what's expected of them and how they're supposed to follow those standards that you're putting in place. So a lot of that happens through our software, while also, like I said, keeping you HR compliant, making sure that everyone's doing everything correctly the way that they should. Christian, I'll kick it to you.
Yeah, you bet. Thanks, Jill. So, Rectangle Health. If you were to summarize where we're at, we are at the intersection of dental and healthcare, IT, and fintech. We're well back financially. We have a majority stake um, from GI Partners out of San Francisco. Now, you see our main three product solutions here. Rectangle Health, we've been around for 30 years. We have a proven successful track record in the enterprise markets, consistent returns on investment, improve EBITDA. But we do this primarily through one platform, one ecosystem spread across engagement, payments, and compliance. So if you're taking a look at the slides here, think of an engagement capability that we're going to talk in depth about today, right? Boosting reputation, increasing productivity. But think scheduling, smart automated reminders, auto rescheduling, wait list management, tools like Fill My Schedule Now. That's one component of our platform. But within the platform as well, we consolidate vendors. So you don't have to go out and piecemeal things together. Bridge payments. Think end-to-end patient responsibility payments and virtual insurance automation and patient financing. All of the optionality for the patient, the automation and for the staff, centralization across the organization for the corporate side, so increase your collection rates, drive down and stay in control of AR. From that same platform, HIPAA and OSHA compliance capabilities, so unifying your HIPAA and OSHA needs, your trainings, your updates, your resources across your organization with centralized hub for access the organization down to the clinical and employee level, see who needs training, see how the progress is going across, digitize logbooks, all your training resources, your documents and policies, incident reporting, emergency planning. I could go on. But overall, if you look at engagement, payments, compliance, some other components that we bring, vendor consolidation, economies of scale, all of these capabilities into one platform, really simplifying things for the staff at the clinical level, giving the patient all of the optionality that they need to have a great experience. We want to boost that reputation for the clinic and for the organization and increase the productivity across the board.
Yeah, and that's really why we've come together as partners, because of everything Christian mentioned that really brings in a way to ease the operations within the practice. And we are able to complement the HR side of that, with these technologies that are focused just in the healthcare space, are built to support just healthcare providers. So we're really excited to get into the engagement piece today, because that is super important as we're talking about, how do we grow our existing practices? Maybe you have more than one practice, maybe it's just one, and you're trying to make sure your patients are coming back. And so, Christian, I think it's important to start. And what does this mean? What do our, the people in our industry need to be looking at and know about when it comes to this topic?
Yeah, of course. So I really love the title of this webinar, right? Boosting reputation, increasing productivity. Because if I were to define engagement, what that means, it's communicating with your patients and your prospective patients, really to increase your production and improve that experience of the patient, so that you improve your reputation overall. Obviously, you want to interact with your community. What that means for us is several important angles to consider. So there are quite a few platforms on the market focused on engagement. Where Rectangle Health differentiates is we're going to give you the ability across your online presence. We're going to make you front and center with 5-star Google reviews, your social media presence, your reviews, your ratings, your comments. All of that's built in when you have also a true, what we call front door integration with your practice management system. So think of secure connections with reliable capabilities and connections, consistent updates, reporting. So all that communication is read and write, going back and forth, so that when you have these workflows, we concentrate on a methodology and a workflow to make the staff more efficient. The software exists to give scaled organizations a blueprint for those efficient workflows for the staff. The patient then, they have all of the conveniences built in: contacting, scheduling, staying in communication, all of the automation for smart reminders built into that patient experience, leading up to, during that visit, and then also as soon as that patient leaves, so that they're prepared and they know when they're going to come back and visit the office again. Oh, am I on this one, Jill? All right.
You are.
All right. So I didn't know where we were going here for sure. But so yeah, of course, you want to continue to build things, right? Word of mouth, building your brand, developing your reputation. All of this hinges on, hey, is that patient happy with how they've scheduled, what their experience was in the clinic? And then are they engaged and are they going to come back, right? We want that recall to be at a high level as well. This also matters for your staff. Your clinical team is there to focus on patients. When they're able to do that, and they're able to do that at a high level, they're going to have the ability, the bandwidth. They're going to be providing that experience for your patients so that your patients stay happy as well. So not only do you want to give the patient everything they need, of course, this is important. It's important for the patient to have all of the tech conveniences that are out there in the market when scheduling, being reminded of those appointments, what's required for and during that visit, along with the ability to conveniently reschedule. So think of everything that the patients are used to on the market today. I mean, we use our phones to reserve a reservation, to go on a date, to take a family out for dinner. We don't even call the restaurant any longer, right? I order my groceries through my app. I schedule an Uber or Lyft ahead of time. Like I told you, I'm heading to the airport right after this. But your staff, your clinical team, they're there to focus on patients. They want to give the proper care, ensure their needs are met, give your patients the best experience possible. That's what they're passionate about. So the more that you can reduce the redundant tasks through that smart automation, reduce the phone calls into the clinic, eliminate the need for the team to spend time chasing down things like paperwork or payments or entering into information, the happier that staff is going to be. That's going to translate over to your patient. And that's going to really bring all of these positive pieces, word of mouth, your online presence, et cetera, is going to continue to increase.
Yeah, and I love this stat that you guys have in here that only 30% of team members are highly engaged. And I think that it's absolutely related to, yeah, the redundancy, not allowing the technology to do things that they are not best at or passionate about so that they can be engaged with the patients.
100%. I mean, if you like your job, you're going to do well at your job, right?
Exactly. Yep. Yeah, so let's go dive into really the meat of this of how to boost that reputation and increase the productivity. So Christian, I'm going to have you start with the first one.
So, yeah, thank you. So, Rectangle Health, we exist as a technology platform in the space. I think when you just are thinking about technology overall, you want to provide really three things. What we do is we provide the patient all of the conveniences that they need from start to finish so that everything is smooth and convenient for that patient, whether it's scheduling, whether it's payment, whether it's making sure that they've got everything they need for the visit. You've got the staff then. We want to reduce those tasks, like I mentioned, provide the automation necessary so that they can focus on the patient. What's also important there is on the corporate side. If you're a multi-location, if you're an enterprise organization, you want to have a centralized access point so that you can see what's going on across your organization in live time, drill down into each clinic, each region, et cetera. But you want to have all of that consolidated, and you want to have one vendor across all of these touch points, not piecemeal together with 4, 5, 6 different vendors to accomplish all of the same tasks. That's where Rectangle Health shines. We do it with online scheduling, waitlist management, et cetera, that we'll talk about here shortly.
Yeah, so next, kind of looking at the team engagement side on, just where do you start? It's really important to set the tone for your practice right from the jump because you only get one chance to make a first impression. And I think asking yourself, what is that new patient experience that I'm trying to create? And am I doing the same thing when I'm looking at that experience I'm creating for a new team member coming into the office? And so it's important to make sure that you're communicating with your new team member what to expect when they arrive. I think that we're in this place right now where we're just trying to get a body into the office and we skip these steps. So, for example, if there's a certain place that they should park, or if there's a certain team member that is going to be greeting them on the first day, or if you have expectations of what they should wear, all of those details should be communicated prior to that employee arriving. It's important to set your expectations from the beginning as well. So you want to make sure new team members receive an offer letter, for example, which outlines the details of their employment. So this should include things like their start date, the time that they are expected to be in the office, the initial days for their employment. This is important actually, not just for transparency for the employee of when you expect them to be working, but also if an employee is asking to change their schedule and that's not something that you can accommodate, you have that documented of what your expectations were from the get-go with the offer letter. It also should include things like the benefits that they'll be receiving. So details of the time off they'll get, insurance benefits, any perks you might have. So that's really important for setting the expectations and then continuing to follow through on that with your onboarding process. So don't forget to have your employees fill out their new hire paperwork. On average, there are 12 to 15 documents that a new employee should be filling out and signing on their first day of work with you. So this number varies per state. Some states are pushing 20, 21 documents. Some are still hovering around that 12 number. So it just depends where you are. If you have questions on this, please reach out to us. about what's, required in your specific state, but just don't overlook this. And because if you don't do it right from the beginning, you'll never do it. So make sure you're starting the onboarding process with those new hire documents. And then your employee handbook should be included in this as well as a way to set your expectations. So if you have not updated your handbook yet for this year, please make that a priority. We have a ton of resources to help you do this. If you're a client, we do it for you. So just don't make that an excuse anymore. I'm not doing it. And the handbook should not only set expectations based on the requirements of your state, but also how your office functions. So, like, what is your cell phone use policy, your attendance policy, your uniform expectations? Those are all things you want to think about and make sure that that's communicated to the team. Also, don't forget to give them a job description. We're going to come back to that, but really important to give them that job description. That's the expectations for them as an individual within their role. Your handbook is, the way that the practice is running. The job description communicates what they're supposed to do individually. And make sure you pay them for the time it takes to fill out the paperwork. So set an hour aside that first day when they come in and set that expectation correctly. If you're going through this and you're like, well, I don't have 12 documents even for my existing team, or my handbook's out of date, prioritize that and then almost treat that as like a new orientation to get things up to standard now. And then don't forget to remind your employees about their meal and rest break options. So again, these laws are going to vary across all the different states of what you're required to do. So make sure you check with us if you're not sure, but also communicating, if the law says 30 minutes, but you offer an hour lunch every day, make sure that you communicate that. That should be in your handbook. You should let them know about that before they come in. And last but not least, set a cadence for check-ins with your employees. So that's both new team members and existing. For new team members, we recommend 30, 60, 90-day check-ins at the very least. And investing in this upfront will definitely lead to better retention efforts. So, all right, Christian, back to you.
Oh, thanks. So let's talk about online scheduling here for a moment. Obviously, there's one way to think about this. That's just how it sounds, right? Scheduling an appointment online. We really look at it two different ways. First, patients, just like we would think with the name of what it is the patient goes on to a website, looks at availability in the calendar, clicks a link, schedules an appointment. That's great. There's also a second way of approaching this, which is in reality far more effective in execution for the patient and staff from what we experience. So think of the same workflow from the patient perspective, but that technology can be applied to an appointment request with smarts behind it so that that request is automatically engaged at the clinical level so that staff can confirm all of the nuances of that appointment with the patient through text and automated reminders. So think of patient, they go online, instead of blindly clicking a link and scheduling, also think of the option here where your patient clicks, they send in, hey, here's my desired time, here's my desired date, but then the staff has the ability to check this request, ensure the nuances of that specific patient, the visit type, the requirements needed, the time as well, are all in check with a confirmation and an open line of communication to the patient for any further Q&A leading up to the appointment. Once it's confirmed, that smart set of reminders can be customizable and then also delivered to that patient on a regular cadence with all of the proper information for that visit, what's required, what the provider needs, etc., so that everybody's on the same page. That's where we've found, in our experience, delivers the most effective patient experience, and tied into the theme here, it boosts the reputation of that clinic and increases the productivity when you're keeping your schedules full.
Mm-hmm. Yeah, and I think to your point, I don't call anybody anymore. Like I do everything online. So, and some people want to call and that's okay, but I think it's important to give options.
Definitely. It's I mean, there's a whole bunch of stories, but when I just think of my life right now, I work from home. I don't really see anybody unless they're my immediate family, and I'm doing everything, on my phone or online when it comes to scheduling or getting groceries, or I'm leaving for the airport here in just a moment. All of these things are just done through text or through online. And so we want to bring that same capability over to the dental space and to the healthcare IT space.
Yeah. Okay, so establishing a team of strong performers takes effort and communication, and it also gives the employees a chance to grow. So when we're looking at doing reviews, really look at this. There's a difference between informal feedback and formal performance reviews. So both should be done. Informal feedback should be consistently communicated, and it's recommended that you have regular check-ins with your team throughout the month. Just asking how things are going, being able to give that feedback in real time, because the longer that it lingers, whether it's good or bad, the more difficult, or you might forget about it, to bring it up. So making sure you're having those check-ins. And then make sure you're doing a formal performance review at least once a year. We recommend to do these at an employee's anniversary date, as opposed to doing those in bulk once a year for everybody. That just helps to relieve like the administrative burden, frankly, from everyone having to go through this. Also, there can sometimes be inflated expectations of, well, it's Christmas time and it's review time, so I'm going to get a raise. And raises really should be tied to the performance initiative. So we recommend doing those on the anniversary date. And making sure that the reviews are keeping employees accountable for their work and allowing them to get feedback on how they can improve. So I really recommend not underestimating the value of transparency that performance reviews bring in for the team. Like, this shows your team that they are cared about, but it also allows them to get a better understanding of what you expect from them. So when you're doing your performance reviews, you want to gather data to measure the performance against expectations. And if you don't have data to reference, it's probably not an area you're ready to hold your employees accountable in. So just think about that. Like, can I measure what I'm asking them to do? And if I can't, that's probably something I need to put in place first before I can actually ask them to abide by those things. You really want to be objective in these conversations. I can't stress that enough. And you should be using tools like the employee's job description as a reference point when comparing their performance to your expectations. So again, if you don't have a job description, for example, that's the place to start. Get those in place before doing the performance reviews. And if you're a client of HR for Health, you get those automatically. They're automatically assigned to every employee. So you don't even have to think about that step, like when you onboard them. We also recommend having employees review themselves, and then you review them in return. So that's how it works in our system. The review goes to the employee first. They rate themselves. There's a free response. It sends back to the supervisor, whoever is assigned as needing to review them in return. So you have all that prep work done prior to meeting, and then you can just document everything from the meeting in the system, and then the employee signs off on it once it's done. If you're in a situation where you have to provide difficult feedback, there are some tips of how to do this. One is staying focused on preserving the relationship. So first and foremost, it's really important to convey the difficult feedback while still treating that person with respect and empathy, because if you damage that employee-employer relationship, you're shutting down future opportunities for collaboration. So you should tell them that the relationship is important to you, and it's not personal, just objectively, because you have this data and metrics. This is what's going on. Also, make sure you're scheduling a meeting. Don't like ambush employees. That can create anxiety of just popping in whenever. So invite them at a specific time to talk, saying, for example, I'd like to chat with you about your attendance. Could we meet this afternoon at 3:00? Like, that gives the employee time to gather their thoughts and prepare. And then if possible, meet in private on a neutral ground. So even if you might have an office, like, avoiding calling them into your office. This shifts the balance of power to your side, and it could put that other person on, the defense. So private, neutral space. Maybe this is a break room with a door, so you can still have that private conversation, sends a better signal that this isn't something that should be embarrassing. This is just us having a transparent conversation. Again, be clear and specific with your feedback. So if there is a problem, be really specific about what that is, how it's affecting others, and what needs to change. So for example, you've been late 13 days in the last 6 months, or you're falling behind with patients each day, which is creating excessive overtime. Whatever it is, make sure that those conversations are productive and are grounded in facts, not just, your opinion on something. And allow them to ask you, or allow them to ask you what your, how they can make it better. Allow them to give you their thoughts on it, and not just have it be like a one-way conversation, making sure that, they have that buy-in and ending with an action item. So ideally that employee leaves the meeting understanding exactly what's expected of them, what needs to improve, and then schedule a follow-up conversation. If you're having those informal check-ins, that's a great time to use that for feedback, because this really allows the employee to step up and provide better patient care and satisfaction. It ties all back into these. They see their contribution to the office and how what they're doing and that how their performance really matters to the overall success. Great.
Perfect.
Christian,
Thanks, Jill. That's good information for my next review. I appreciate that. But hey, so let's talk waitlist management. We'd love to live in this world where every patient that schedules an appointment comes through and they're on time and they come for their appointment, right? 100% of the time. But we know that that's not going to happen. Inevitably, patients are going to be needing to cancel an appointment. We're going to make opportunity for a wait list to be executed on, right? So patients are going to be needing an appointment, and that particular clinic may have openings, they may not, for that patient on that particular day of the week. But this is one of the ways where our platform will shine. So when we add a patient to our platform and then we add them into the wait list, let's say they get a text message telling them, let's say a patient texts in and says, hey, I can't make it, but can I be on next Tuesday? That's full. We're going to add that patient to the wait list. As we're leading up to that next appointment, they're going to get a text message telling them that they're on the wait list. It's a real thing. Then if another patient cancels, through one of their reminders that are automated, they're smart, they're going out to those patients on customized cadences, the system is going to automatically start offering that time slot once a patient cancels. So we look at our wait lists and what wait lists should be like as essentially a virtual waiting room. So here's one way that it can work. Let's say we have a patient calls in. Let's call him Joe. Joe calls in, or he texts directly and he says, hey, Jill, my crown fell out. I'm in a lot of pain. I need to see Dr. Smith ASAP. Well, so happens Dr. Smith is full, right? The schedules are full for today and tomorrow. We want to get Jill, we want to get you in, but schedule's full right now, but we're going to add you to the wait list as a priority patient in that wait list. So based on groups or locations, we're going to add that patient directly to our wait list. Built into our solution are going to be smarts into the specifics of that appointment, time, the provider, the preparation needed. And if it's a priority patient, they're going to get first option to be communicated with and to confirm an appointment once that opening happens. So when that patient cancels last minute, our software automatically is going to tap into that wait list, blast out a text with any of the patients matching the parameters that have been set, right? Time slot, provider, and so forth. The patients are going to get that message, and then it's on like a first come, first serve basis. So the patient's going to respond, confirmed. Once we're confirmed, we're going to send out a message automatically to all the other patients on the wait list, letting them know that that time slot has been filled, but they're still on the wait list for the next opening. We know appointments are worth, there's a value to every single one of those time slots, and we want to maximize the ability for that clinic to generate revenue from those appointments. We're seeing at least 15, 20, 25% in reduction of no-shows or missed appointments from the platform that we put in there, from having a proper wait list management strategy.
Mm-hmm. And I didn't hear you mention too much bogging the team down in that process, which is amazing.
Yeah, thank you for that. So the system is designed to do most, if not all of that, automatically behind the scenes without any engagement from the staff.
so important because they can spend their time doing other things, being productive at that
100%,
point.
yeah. I mean, they're busy already. So if a patient
Right.
cancels last minute, well, of course, we want that to be automated to fill
Hmm.
that appointment for that new patient to be educated and to know what they need to bring for the appointment, when, where, how, etc., and have all that happen. When that's working, that's really the basis, the crux of what our solution does. And obviously, I mean, to fit in the theme of our webinar here, that's going to boost the reputation. If you're a patient that needs to be seen and your clinic can get you in quickly, that's going to increase the reputation, boost your reputation, but it's also going to increase the productivity if you're missing those opportunities today.
Yeah. On a similar vein of scheduling, we have found at HR for Health that it's very common to have the employee scheduling piece be an afterthought. We think a lot about how the patients are managed, how are they coming in, but when it comes to how the employee schedules are communicated, it's written down on a calendar, that's posted in the office, or it's on a Google spreadsheet, or wherever it might be. We even had a client tell us they physically wrote down the schedule on a piece of paper, took a picture of that, texted it to their team. And all of those processes do not give the employees transparency, and it doesn't set up an environment where accountability comes easy. So we recommend looking and assessing, what is your current employee scheduling process? Have I kind of overlooked that because I'm just focused on the patient side? And I can't have my patients receive treatment if I don't have my team there. So you want to make sure you're also looking at the employee side of it. So we recommend an electronic employee scheduling tool that not only communicates to the employee when they're expected to start work, what their position is going to be while they come into the office. A lot of our, all the way from groups to our smaller practices, employees wear multiple hats. And so it's important to know, okay, today I'm a dental assistant versus front office or whatever it might be. And giving them that transparency of when other people in the office might have time off already in there that could impact the schedule. We hear a lot from clients in these industries of, I always have issues of conflicts of who requested time off first, or my entire team wants to take off, my entire back office team wants to take off on the same day. Well, if you're giving them transparency into what the schedule is and they're able to see when other people have pending requests in, they don't need to know why they're out of the office. They shouldn't have that much transparency, but just being able to see, what conflicts could potentially come up, and also if there's open shifts. So all of that should be taken into account in the system that you're using. And ideally, also looking into the scheduling rules for the employee, meaning it's also tracking if the employee clocks in late or clocks in early or is a no-show, doesn't show up at all. Like, you need to know about that in real time so that you not only have that documentation, the team is aware. We actually had a client tell us that their employee told them, I was going to stop at Starbucks on my way into work today, but I didn't want to get the little tardiness flag, that I was late, so I didn't. So we see that behavior changing when they know that you're paying attention to it and that they have that visibility too. Also on this, it's important in that whatever system you're using, whether it's HR for Health or another system, that you're able to schedule their meal and rest breaks for them so that they understand that they're supposed to take time to themselves. They're supposed to clock out and do, whatever they want for 30 minutes or an hour or whatever your policy is. One word of caution here, if your current system clocks them in and out automatically based on these scheduling rules, that's a problem because an employee's definitely going to say, I was forced to work off the clock because things happen. Sometimes they can't clock out for lunch right away or whatever, a patient goes over. So make sure that the system is either in HR for Health or something similar that just has these things documented for you, but it's not prohibiting somebody clocking in and out based on that schedule. But if you're not investing in an employee scheduler that's digital, that they can have access to, that makes it easy for you to schedule them, I would definitely recommend making that a priority so that that satisfaction for them increases and you also can hold them accountable and know who's supposed to be where when.
Awesome. Um, you know, a big part of boosting your reputation and increasing your productivity is understanding where you are at today and then setting some goals and understanding how you're going to get to where you want to be tomorrow. We do that by surveying the patient and understand that patient experience and having access to that data across your organization. So think of capturing patient surveys and reviews right after the appointment. That's key. You want to do that in a convenient, automated fashion with the customizations that are available on the market. When you have a patient that just had a great experience and it's still fresh in their mind, we want to capture that. Conversely, if that patient has an experience, let's say maybe it's less than satisfactory, those can happen. We want to connect with that patient right away. We want to make it right for them the next time, and we do that by understanding what went wrong during their visit. So overall, when you think of surveys and reviews, we instantly want to find a way to compile that patient response with a one-click. We want to turn that raw survey data into a summary report, showing the graphs, showing the charts, showing the results at a clinic, for a certain provider, for a region, for a full organization, across all of the patients and the providers. So you think of your net promoter scores by clinic, region, across the organization. There's opportunity in that data for replicating best practices. If you find a high-performing group or a high-performing clinic or region, we want to make sure that we can drill down into that. What are they doing right? How are they doing it? What can we replicate from that experience and have that implemented across the rest of our organization? So we want to use that data that we capture from those surveys and reviews and put it in play. Anything less, from an online reputation standpoint, we want to obviously promote the 5-star reviews that are out there. We want to put them on Facebook, put them on Google, whatever the case is. But we want to do that in a way that promotes the practice. But anything less than a 4-star review, we want to make sure that that patient has a quick opportunity to provide feedback before maybe they also go online and provide feedback for the general public to see as well. So we've got some automation built in. We've got some ways that we can make that happen. It's a great thing to do and put in play for part of your strategy for your organization. But at the end of the day, you want to know how that patient's experience went. You want to have a convenient, easy way to collect that data in order to identify what you want to replicate, what you want to fix across your organization. You want to improve the overall decision making for the organization. That's part of the strategy that needs to be implemented, and it's going to certainly lean into boosting the reputation and increasing the productivity for your clinic, your provider, for the rest of your group.
Yep. Okay, so encourage your employees to take the time off that they have available. I know that this might seem like, yeah, of course, but it is important to be intentional about this. And this starts with your employee handbook. So make sure what is in writing is what the employees are actually getting. So we see a ton of discrepancy before we start working with clients that their policy that they have written out is not actually what the employee is getting because things have changed over time. You haven't kept up with your employee handbook. Like, life happens, but it's really important to make sure that, again, what you have in writing for that policy that you have given to the employee of this is what you have offered is matching with actually what they are getting. This is important, not just from a compliance perspective, but also for building trust with the team that, you put your money where your mouth is, that what you say they're going to get, they actually get. And once you provide your policies to the team, review the time off section with them. This, I think, is something that's overlooked a lot. There are certain things in the handbook that are kind of, I'm going to call standard, that are, their standard leave of absences that they're able to get through the, state required laws and PTO. Those are things that you really want to highlight and make sure they know. So reviewing that section so that they have time to ask you questions if they have questions. This is also a great time to remind them of what your policy is on multiple people requesting time off at the same time. Your policy on how early they should be requesting time off prior to needing that time off. All those little nuances that can create some friction in the office. This is a time to be able to get in front of it and address those expectations. and then encourage them to take that time off if they have it available. And again, communicate with them of how you want them to tell you when they need time off. So is that done through a system? Ideally it is. Ideally you have a software that's connecting the time off or the timekeeping to the time off. So as employees are working, they're accruing those hours. And then it's really important they have that transparency of I should, as an employee, I should be able to easily see how many hours I have available whenever I want. I should have that transparency into a system. I shouldn't have to ask an office manager. I shouldn't have to look at a calendar on the wall or my pay stub. They want to see what it is in real time. And then that also can encourage them to take time off and to actually use that, because being able to take time off out of the office, again, making sure it's in line with your policy of how far in advance they need to request it off, not having duplicate team members in the same positions, taking time off. But once you get past that stuff, it's really, really helpful for everybody to be able to reset and have time out of the office, because if they feel like they can't have that flexibility, that's where friction starts. So that definitely leads to happier employees, a better reputation if you're looking to recruit. So keep all those things in mind when you're assessing what your current system is.
Oh, awesome. So let's think of appointment reminders, two-way texting across your platform, how you engage with your patients. You want to have a platform that has a smart cadence and a series of reminders to that patient that's designed to make sure the patient shows up and is prepared for the appointment. It needs to start when that patient initially schedules that appointment, whether it's online, whether through an appointment request or response to a marketing campaign. And you want to have it continue all the way up through maybe a last minute nudge 2 hours before the appointment actually takes place. Your platform, or if you want to implement and you really want to maximize that appointment reminder system, think of all of the notifications, booked acknowledgments, early reminders, 14-day, 7-day, 5-day. You want to have your appointment reminders. If they're not being confirmed by the patient, you want to have a secondary methodology to go ahead and make sure that that patient confirms or cancels. So you want to have some smart capabilities built into the platform in order to do so. Think of nudge reminders. These are going to be the ones that really get that patient engaged at the last second, or they're going to go ahead and cancel that appointment, which then offers that opportunity back to what we stated before on wait list management and virtual waiting room, so that you can fill that appointment. Look, no-show rates in dental, they can be anywhere between 10, 20, 30%. It can be an issue. And we know that this carries a hard cost across every single appointment that's missed. So we want to make sure to be on top of that and have a system that's engaging with the patient, but carrying the flexibility and the smarts in order to make sure that we're filling those schedules. And from a texting perspective, there's no better way to do it. It's 2024, right? Anyone and everyone is on their cell phone pretty much all the time. Pretty soon, Jill, we're going to be doing webinars like this, probably via text. There's probably going to be some AI avatar. There'll probably be some AI avatar translating our text into like realistic conversation.
Yeah, you're so right.
But look, patients overall, statistically, they don't want to have to call in unless they absolutely have to. I'm like that. Just about everybody else I know is like that. But the data that we show, the market research we put in, backs up that sense, right? Where if we can, we want to do it through our technology, namely through text and the communication. So patients overall, they don't want to call in. They have to have that option, but the primary method of engagement is for that patient on their cell phone. And this is a great opportunity for everyone. Think of the patient, the staff, and on the corporate side, now you can collect all kinds of data to understand what that patient is doing. You can have so many people across the organization assisting and making sure that that patient arrives on time and is engaged. It doesn't have to be one person answering a phone call. If a clinic is short-staffed for a day, you have a capability of coming in and assisting a clinic remotely by handling their engagement and doing their two-way text for them. So, you know, two-way texting, smart appointment reminders, you need that across your organization at the clinical level. And frankly, it's a market expectation from the patient perspective that that's the way that they're going to be engaging with that clinic unless they absolutely need to have someone on the line.
Yeah, which is actually a great segue into one of our final points, which is when I say give your employees an Amazon experience, I don't mean offer the same benefits as big box stores or anything like that. What I mean is employees are expecting the same experience with their employment that they are getting as consumers. So using the example of Amazon, because we know from Amazon and Christian's given a ton of fabulous examples of how easy to use all of these things are as consumers. But with Amazon, like we know exactly when our package is going to be delivered. I know that that's 2 blocks away. I'm waiting for it. I have full transparency. And there is that amount of transparency and ease of use that comes in our day-to-day lives now that people just expect. But that's not translating back to an experience from the employment perspective. And that can create frustration for the team. So if I can see that my package is 2 blocks away, I'm definitely going to expect that I can also do something as seemingly simple as logging into a software and seeing how many hours of vacation I have available, requesting that right from, the platform, not having to track down my manager, track down my policies, and this applies to all areas of employment. So transparency around their schedule, not just the patient schedule, but when is the employee supposed to be there? Are they easily able to see if they can trade shifts, all the hours that they're expected to work into comparison to the hours that they actually work? Do they have a system where they can go in and estimate, okay, I worked this many hours this week, this is what my paycheck's going to look like? Can they easily go in and see the time off they have available? Even things like the employee handbook, like, is that currently accessible for your team so they can reference it whenever they want? Or is it printed out in a drawer where they have to ask somebody or first of where is that document? Can I look at it? So that's not the experience that your team is wanting. And so it's important to look at the HR processes as a whole. There's so many individual things we talked about today, but if you leave with one thing, really looking at, is it easy for my employees to be bought into what I'm doing and what I'm telling them I'm going to do? Is the software I'm using streamlined? Is it intuitive for them to be able to use on their own, not creating frustrations when they're trying to do these things? And am I really holding up my end of the bargain for what I'm asking from them? So just like you're concerned about your patient experience, but you absolutely should, but you should also be concerned about your employee experience and using the technology to make that easier for them and for yourself.
Love it.
All right,
Love it.
but not least.
Yeah, how are we doing on time? 12 minutes? Okay. So, hey, look, digital forms. This ties in, obviously, with the automation on appointment reminders and two-way texting, surveys and reviews. Everything is digital. Gone are the days of patients filling out paperwork on a clipboard when they arrive at the clinic. Jill, I'm sure you probably remember that. I remember those days literally filling out the same information multiple times over and over again on a clipboard as you're waiting for your appointment. Then I feel bad. The staff would have to take that paperwork from each patient, go in, have incomplete sections, terrible handwriting. They'd go in, they'd have to fill out that and then manually enter that information into their system of record. Look, the market expectation is for digital forms, for registration, and all of the other pieces of paperwork that patient needs to fill out in their experience. It needs to be delivered via text and or email so that patient has the ability to go in, fill out the information prior to their appointment. When they have time, maybe it's on a weekend or an evening before, and for that information to be delivered to the clinic ahead of time. That is going to make, when the patient arrives at the clinical level or to the clinic, that's going to make that experience far more enjoyable for the patient. Patient conveniences and reducing the tasks of the staff are key when you have the technology to do so and embedding that automation accordingly. These are all ways to boost that reputation and to increase productivity across your clinic.
Yep. Away with paper.
No doubt.
All right, Christian, you want to wrap this up for us? As I'm like, I know you got to get to your flight, so we'll go
Right.
through the conclusion. I'm like, I don't know if we have time for questions, but we will, since Christian's got to get to the airport. But like I said, if you guys have questions, put them in the chat, in the QA. We will get back to you.
Of course. Well, Jill, first of all, thank you for having me. It's been a great conversation.
Yeah.
If you want to summarize what we're doing across the space, what this brings to the market, from a strategy perspective, you want to boost your reputation, you want to increase productivity. A clinic or an organization, you really need to be utilizing modern day technology, software programs. The capabilities are out there to drive down AR, to increase your execution rates on your appointment, to bring automation to the table so that your staff can stay engaged and to be happy with what they want to do, which is to provide a high level of care for the patient. That's employee satisfaction right there. You want to have your team buy-in. Those things combined are going to create a confident and uplifting company culture, because now you know that you're truly helping patients, you're helping people stay healthy, you're a positive contributor in your community when it comes to that. So that's, if you're bringing the technology and the automation there, you're going to have happy employees and happy patients accordingly. To continue there, obviously as the patient, if I'm able to utilize the conveniences that I'm looking for in the market, whether it's engagement, whether it's payment, scheduling, etc., I'm going to be more satisfied, because most of the patients out there have a very busy lifestyle. The more conveniences that we can offer, the capability, the higher likelihood that that patient is going to stay engaged. And when they're happy, they're going to provide those online reviews that are going to be circulated throughout the community. So many patients out there, before they choose a provider, go on and of course check online to see what the reviews are, to understand how that clinic operates. To be a trusted practice in the community, you need to implement these conveniences so that over the course of time, people understand how you're operating, how you're providing that level of service for your patient. And all of this ties in for first-time patients and to keep your patients coming back. That's going to boost your reputation. That's going to increase your productivity at your clinic, or if you're at a scaled organization. All of things are going to tie in here, and it's going to be a great experience for all.
Yeah, thank you everybody for joining us. If you have any questions about the stuff we mentioned, the new hire documents for your state or requirements for your handbook or anything specific, or if you just want to look at a demo of HR for Health, you can scan the QR code. Our team will reach out to you to help walk you through that. Thank you so much, Christian, for joining us. This is really fun. And as I mentioned, if you have questions, we will definitely get back to you. Sorry, we had to cut it short. Christian's got to get on a flight. We can't have him miss his flight. But we appreciate everybody joining us, and stay tuned for our next session with Rectangle coming up here in the next week or so. But until then, thank you for your partnership. We really appreciate all you're bringing to the marketplace.
Appreciate it, Jill.